Welcome back, Lab Insiders. My name is Maximilian, and as always, we're here to bring you an abridged version of our full interviews. Joining me is Zisis Kozlakidis of the World Health Organization and the International Agency for the Research of Cancer. Welcome back.
Thank you very much.
Zisis, without taking up too much of your time, because this is our special Q&A segment, I wanted to ask you, where do you see these innovations in technology going?
I see them being integrated a lot more in our routine healthcare practice. So we've tested a lot of them during the pandemic. We now know they work. I anticipate that we see them being part of our healthcare in the next few years.
What do you believe that the future lab will look like in 5 years' time?
At the moment, we see a big push in labs towards automation. This is just for handling samples and because we have to respond to scaled up demands because of emergencies, but there is already a push towards automation. I see in 5 years' time that we'll move from that technical automation towards a more data-driven decision support system where it's not only about the automation, but how do we interpret the data that this automation is giving us all the time.
How well do you think we're prepared for the pandemic or for any future challenges?
Well, I don't think, honestly, anybody is really ever prepared for the pandemic. But I have to say a lot of labs were very well prepared for short-lasting shocks because different parts of the world had already dealt with natural disasters, earthquakes, typhoons, you name it. So for the short period of time, there was a very good response. I think where the challenge came was for the extended period of time. So, for example, in the case of biobanks, and these are the big repositories of biological tissue that normally collect samples for research and for pharma investigation. They were roped in to the pandemic response because they could deal with processing large amounts of tissue. And they could do it very well, but they were designed as emergency response for a short period of time. The longer period of time needed a lot more discussion, a lot more funding, a lot more political will to make it happen.
And that actually brings me to my next question is what do you think really needs to change?
I think perhaps to take the wider look in healthcare. So not look into the very acute phase of I'm sick, I need something to happen to me to make me better right now, but look towards the healthcare continuum. So things that are allowed to predict conditions before they manifest themselves. So once you're in the hospital and you have a treatment, then be able to rely on digital technology to follow up on you and highlight any follow-up activities if they need to take place.
Would you have any particular advice that you would like to give to any lab manager currently facing these issues?
That they're not alone. And I think this is very important to say. There is a wealth of information that's coming out of discussions, whether it is as part of large international institutions or local ones, but the impact that we see that the pandemic has had over the last years has been reflected many times over in different locations internationally. And I think there are little nuggets of very important information that one can take out of these discussions.
With that said, do you have any recommended readings or media that you would be willing to share with us?
Yes, I have provided some articles and publications that I find of interest, and to a large extent they also represent the way that I'm thinking. But in terms of a book, I've recommended one of my favorite books, which is The Ghost Map, and it's how one of the first ever recorded epidemics was dealt with. And that was 150 years ago. And there is still a lot to learn in terms of how the community leaders need to be activated, they need to be engaged. And medicine and laboratory science by themselves can only take you so far. You need all the stakeholders to be involved to actually make a success. cases.
With that said, if for all the other the clinical articles and the research articles, we've attached those to the comment section below in the video, so feel free to get up to date on those. Zisis, thank you for your time.
Thank you very much. It's been a pleasure.
Zisis Kozlakidis of the World Health Organization and the International Agency for the Research of Cancer. Thank you.